These two new molecules are going to put an end to steroids, and you are going to witness it. It is well known in the scientific community that anabolic androgenic steroids pose serious health risks and are potentially lethal. Their widespread use is a threat to public health, and we don't know how to stop them. But imagine a molecule that had the same anabolic effects on muscle while sparing other tissues and therefore minimizing side effects. Does this exist here? Dr. Borja Bandera, endocrinologist and nutrition specialist. Today we explore how the body recomposition industry is about to change forever. Anabolic steroids, popularly known simply as steroids, are drugs that are used clandestinely to increase muscle mass and physical performance. Not without serious consequences, they remain a growing public health problem. They take lives and worsen the lives of those who use them, even though at first glance it might seem to you that the opposite is true. Those consequences are derived from the so-called androgenic side effects. What are they? Let me remind you. Taking testosterone or its derivatives, especially in high doses, strongly stimulates androgen receptors. But you don't only have androgen receptors in muscle, they're also in tissues like the prostate, heart, hair follicles, brain, and liver. So what happens? Severe acne, hair loss, increased body hair, worsened lipid profile, higher anxiety, irritability, aggressiveness, prostate enlargement, urinary symptoms, testicular atrophy, and inability to produce natural testosterone, hoarse voice, clitoral enlargement in women, and likely increased cancer risk. But there is one side effect that is the worst of all, a very considerable increase in cardiovascular risk. For this reason, the leading cause of premature death among users is cardiovascular. Are you analyzing this? Bodybuilding is among the few sports that lower life expectancy, a trait it shares with certain strength and contact sports. Keep in mind, steroids aren't just used in bodybuilding. Ultimately, anabolic steroids are not drugs designed solely for muscle growth, but for the masculinization of men, and be careful, of women too. And this, especially at high doses, threatens your life and your health. But can you imagine a family of molecules that acted only on the muscle, greatly facilitating its growth, but still fully respecting your other tissues and organs, while also helping you lose fat? This family of drugs would put an end to the clandestine use of anabolic steroids, since those who use them don't want to have side effects on their health. Of course. Okay, does this exist? Are you still watching? Regeneron has published preliminary studies on the development of a combo of two molecules aimed at obesity. They're going to change everything. Trevogrumab, a myostatin antagonist, and garetosmab, an activin A antagonist, are investigational drugs in phase 2 studies. This video discusses potential future developments. It's not something you can access in any way unless you're one of the participants. Here are some of the ongoing trials. How do these new drugs work? Well, both reduce the activity of myostatin and activin A, which are proteins that limit the growth of skeletal muscle. They are ligands of the transforming growth factor, beta family, which activate a series of proteins that ultimately slow down muscle protein synthesis in the nucleus of the muscle cell, the myocyte. Remember, this cow, it has a myostatin deficiency. Imagine agonism of the muscle breaks. It's not dichotomous, and it's also gradable. With higher doses, there's more inhibition, and with lower doses, you can achieve more moderate inhibition. So, the company Regeneron has studied the effect of these drugs in people with obesity. With what goal in mind? For body recomposition. But first, they did a study in a few monkeys. The key here is that they're not studying its effect in isolation, but in combination with another drug that already exists, and you probably know, semaglutide. Ozempic, Rybelsus, Wegovy. You've heard those, right? I'm telling you this because the results in this study with monkeys are spectacular. You'll see. During the 20-week study, the monkeys were split into 4 groups. One group of natural monkeys was on a diet without medication. Another group of monkeys received semaglutide, the glucagon-like peptide 1 receptor analog. Another group, the third, received semaglutide and trevogrumab. And the fourth group received semaglutide, trevogrumab, and garetosmab. These ones were loaded up. Well, the results were wild. The natural monkeys lost 400 grams of fat. The semaglutide group lost 700 grams of fat with more loss of muscle mass. This is important, and the semaglutide and trevogrumab group lost 1,300 milligrams of fat. But that wasn't the best part. This last group, which used the myostatin inhibitor, barely lost any muscle mass, only 15 grams of muscle, while the semaglutide-only group lost 100 grams, about 7 times more muscle loss. But we didn't stop there, did we? There's also a fourth group. The monkeys that received the full combo, semaglutide, trevogrumab, and garetosmab, lost, listen, 1,400 grams of fat, but also gained 400 grams of muscle. I'll say it again, they lost a lot of fat and gained muscle. This is ridiculous and doesn't make sense. Think about it. Monkeys, by definition, don't do strength training, and they were in a significant calorie deficit because of the semaglutide. They don't have any mechanical stimulus other than moving their bodies through space, and I don't think they had them in the jungle. Do you understand the magnitude of the findings? What we're seeing are drugs that nullify the effect of ether on lean mass, which is present in glucagon-like peptide, 1 receptor analogs. This is a very important milestone, since it's the main danger of these drugs that are widely used for obesity. But even though we are similar, we are not monkeys, so we need studies in more advanced phases in humans, while preclinical studies are done in animals. Phase 1 and 2 clinical trials are the initial ones already completed. They involve a small group of humans and focus on the molecule's safety and early effectiveness. Alright, this is the COURAGE Phase 2 clinical trial whose results have just been published. This study was presented at the European Association for the Study of Diabetes, in 2025. It's semaglutide combined with trevogrumab and garetosmab for obesity. Therefore, they studied adults with a body mass index over 30 for 26 weeks. These adults were randomized to a group with semaglutide at 2.4 mg, which is currently the highest dose of sema we have. Another group received sema at 2.4 mg and trevogrumab at 200 and 400 mg. The third group got semaglutide, 400 mg trevogrumab, and 10 mg garetosmab. Alright, they mainly measured percentage changes in lean and fat mass using a dual energy X-ray absorptiometry scan along with weight. And what results did they find? Pay attention, because they were incredible. With high-dose semaglutide alone, 33% of the weight lost was lean mass, 1/3. This isn't surprising, as previous studies have shown the same. But adding trevogrumab cut that loss of lean mass in half and further increased the loss of fat mass. But watch out. The combination of the therapeutic triplet achieved fat mass reductions of 27%, with only 7% of the lost weight coming from muscle. That is, they lost an average of 12 kilos of fat, not just weight, and less than a kilo of muscle with the maximum potency combination. This is a pharmacological body recomposition never seen before, which could only have been achieved until now, with semaglutide or tirzepatide at high doses, and in addition to steroids, with the unbearable side effects that would be generated. However, what's revolutionary here is that the androgenic side effects wouldn't be present. But are they lying to your face when they tell you that these drugs won't have side effects? Alright, believe me, I know the industry, and yes, they're going to be groundbreaking. They'll be very useful, like glucagon-like peptide, 1 receptor analogs, but won't be without side effects. I'm going to tell you the ones I anticipate right now, so stay tuned. First, burn this phrase into your mind. There are no effects. Yes, this rule is basic in pharmacology. If something has the potential to exert a powerful biological effect, it has the potential to cause side effects. First, yes, there were side effects in the studies conducted. These included expected effects from major and aggressive weight loss, muscle cramps, nausea, constipation, fatigue, diarrhea, headache, acid reflux, viral infections, and more. None of them were serious, but they should be taken into account. In the therapeutic triplet group, there were also 2 deaths that, at first glance, do not have a causal relationship with the drugs. Remember, these were people with obesity and high cardiometabolic risk, but it's still a yellow flag. And some reflections. In the cardiac muscle, there's also activin A and myostatin. As far as I know, what does this mean? Why do I say this? First, who guarantees the effect is limited to skeletal muscle and won't impact cardiomyocytes? Could they generate effects? Hypertrophic cardiomyopathy? I'm just throwing the idea out there. Second, body dysmorphia will keep increasing to unimaginable levels. Where will society end up? Access to these drugs is initially going to be very elitist, so the differences between aesthetic and obese bodies, according to economic factors, are going to skyrocket. Let's continue with tendon and ligament injuries. They're going to increase a lot since these drugs don't strengthen connective tissue, only skeletal muscle. Second, the non-physiological growth of muscle mass, well above statistical normality, brings additional problems. Obstructive sleep apnea, mass, osteoarthritis, limited mobility, etc. Do you think increased muscle mass is better? You're mistaken. Muscle is healthy, but only to a point. Many former steroid users will switch to using these molecules, and we don't know if they are less or more potent in terms of muscle growth than steroids. We'll see this in bodybuilding since they'll buy it as soon as it's released. If they manage to reach the market, they're going to be very expensive. They're monoclonal antibodies. And I say if they manage to, because they still have a long way to go, and I don't think it'll be available before 2028. Given what we've seen and the many interests involved, they likely will. Think about it, there are millions and millions and millions of people who would benefit. Since one of the problems with drugs like semaglutide or tirzepatide is the loss of muscle mass. Because even though we professionals want it, patients don't always do strength training or don't train at the necessary intensity. And I have mixed feelings about it, I admit it. For the first time, we're focusing on the muscle, and I see that millions of people could benefit from this. The pharmaceutical industry knows this and is responding. However, there's something that saddens me, which I leave for reflection. The nature of human effort to achieve worthy goals is fading away. We live in a time when technology advances so quickly that all our problems will find a solution without effort, which, without a doubt, will generate other problems of the spirit that are beyond the scope of this video. It's paradoxical, dystopian, and almost perverse to live in a society that leads you to a pathological body composition, only to then offer you the solution. Expensive drugs were the first solution to obesity, but they were only funded in specific cases. Glucagon-like peptide, 1-receptor analogs, although they're far from being a solution to obesity. What's going on? Did you lose muscle, not just fat? We have the antidote to this, and it's clear: strength training, but we're so incapable of sticking to a healthy lifestyle. So another solution comes up from the pharmaceutical industry. Drugs that make your muscles grow without effort. The only way to escape this dystopian reality is to take responsibility, decision by decision, day after day, for the most sacred thing you have. And that's what we're here for. I'll see you in the next video. Thank you for your time and your subscription. What do you think about these new drugs? What consequences do you think they will bring to society? If they become available, would you take these drugs? We'll read your comments. Big hug. Let's keep empowering each other.